Good afternoon. I call this Oversight hearing to order. Last month, we heard directly from tribal leaders and Native health experts on the front lines of the fentanyl crisis that is devastating Native communities across the country. We learned about the unique factors that complicate fentanyl response in Native communities, such as checkerboard, criminal jurisdiction, minimal data, structural barriers to resources for law enforcement, prevention, intervention, staffing, and housing. And yet Native communities are responding to the crisis with strength and determination. Promising culturally based practices and tribally run dedicated treatment programs and recovery facilities for fentanyl misuse are on the rise and seeing great success. Our hearing last month was important not just for our work on this committee and in Congress, but also for the executive branch to better understand the situation on the ground and inform our next steps. That's why today's hearing with our federal panel is an important follow-up. We will examine the adequacy of federal resources to address the fentanyl crisis in Native communities, from public safety to treatment and prevention. The United States must live up to its trust and treaty responsibilities to promote the health and well-being of American Indians, Alaska Natives, and Native Hawaiians. And that responsibility includes responding to modern threats, including fentanyl. So I'm looking forward to hearing about how the administration's national strategy to combat fentanyl actively considers Native needs, identifies gaps in resources and interagency coordination, and supports Native-led solutions. Before I turn to the Vice Chair for her opening statement, I'd like to thank all of our witnesses for joining us for this important discussion. Vice Chair Murkowski.